Want to 10x your growth? Discover how only 3 growth hacks in 10 days can change everything. Welcome to the 10-Day Growth Hacking Challenge with your host, Nader Sabri. We are super excited today. We have a super interesting company with us called Klaim. For those of you that don't know much about or have not seen the kickoff video, go to the first video or go below to get more information about Klaim. Welcome aboard, Vlad. Vlad is responsible for the whole team today, so he'll be taking on making the challenge move. Before we get started, and those who are wanting to learn more about what we do on the challenge, it is all here in the growth thinking design methodology. If you want to do what we're doing here, this is your tool. Welcome aboard, Vlad. How you doing, man?
Doing great, Nader. Thanks for having us.
Awesome. No, I mean, it's a pleasure. I mean, you guys are a very interesting company, and you're tackling a very interesting space. As just a complete recap for the audience, Klaim specializes in something called revenue cycle management in the healthcare sector. Basically, it is the grease that greases the wheels to ensure that patients get what they need, the facilities stay up to date, and it all comes down to being able to get payment moving quick enough for everyone in the system to work. I think I've summarized that correctly. Yeah, awesome. So we're here on hack number 1, ladies and gentlemen. So what I'll do is I'll hand it over to Vlad. If you can just explain to everybody what hack number 1 is, how it went, and what the results look like. Go for it.
Yeah, sure. Before I jump into it, I just want to mention something. This morning, actually, we won a key PMG Innovator Award. In the Middle East, that we are recognized as one of the top, the top startup in terms of innovation. So yeah, we're proud to win that. I think adding on to your point is that everybody understands how huge the problem is that we're solving. We understand it as well, most importantly, and now we're like taking steps to kind of go forward and grow. So going back to your question in terms of the growth hacks, last time we discussed with you the growth hack number 1, which was creating a marketplace, right? We're giving money to people, to healthcare providers, basically, we're giving them cash so they can survive, they can grow, but we need to take this money from someone else, right? Somewhere else. So the growth hack number 1 was like kind of creating a marketplace where we can assign the credit score or rating to healthcare providers, and then bring them and connect them together with investors, kind of, which was not done in the Middle East. Not sure about US. I have to check, by the way, for US. We started moving forward. We talked to about a couple of people how we can make it actually happen, and we found out couple of points where you need to be regulated to do a marketplace, because it's a financial sector, so you need to be regulated. And that's, as we discussed, Nader, with you, like at what point we need to be regulated, and how do we take it legally, right? And do it properly. So I think that's where we are. We started rating already kind of the healthcare providers, started to put them into the score, give them the score, and then based on that, try to see where they fit in. And the idea with giving them a rating A+, B+, C+, and then it's also going to help us basically to sign them in, right? We have a waiting list right now, and we cannot serve everybody, right? All of them, they have cash, but we cannot serve everybody. They need cash. They don't have cash. They need cash, but we cannot serve everybody. So by giving the rating, we will be able to, put people on waiting lists and say, okay, if until you reach B+ or A+, you're not qualified. So you need to reach A, B, whatever, and we can help you with our other product, which is software. So this is what we're kind of planning out right now in terms of the legal structure, how we can do it and bring it to life.
Awesome. And okay, so the results with that yet is you're still working on the hack, right? It's not complete yet. Is that correct?
Yes, that's
okay.
correct. Yes.
Okay, awesome. So guys, I mean, just for a bit of background, ultimately what we're talking about here is equivalent to the Moody's or Finch rating system of healthcare providers at least in the UAE at the moment. And the team brought up something very good. I mean, Vlad mentioned now, and we were talking about earlier, which is regulations. I'm going to address that very early on here before we go into the growth hack itself. So regulations is ultimately driven behind when a transaction takes place, and a regulator's job is to protect all parties involved in a transaction. Ultimately, with this growth hack, at least at its early stages before you become a full-fledged marketplace and be able to implement the service, ultimately is that you would be an information service that provides just the information, but the advice is not provided in the sense of what would be a good or bad investment, but rather what would be a rating based on data that is provided in the best quality, not regulatory, but the best possible protocols that you put in place. So the protocols and the standards that you will put in place eventually as you run this test are going to be crucial to people understanding the level of quality that you have in the sense of the rating. And one of the biggest advantages for those who are tuning in regards to Klaim, not also do they have a lot of data and they're a data-rich company, but ultimately they have probably the most data in the country. Correct me if I'm wrong, Vlad, but you probably have the most data in the country related to healthcare facilities and their credit worthiness. Is that correct?
Yeah, that's correct. So we have right now about 8 to 9 million data points. Wow. From across the UAE in terms of claims, when they paid, how they paid, all of the data that basically you need to get in order to be able to make good investment decisions.
Awesome. So all the more reason why I believe Klaim is in an extremely competitive and unique advantage and need to execute this one hack to move on to the next ones, because ultimately getting this scoring system, even if this scoring system is at its most simplest levels, okay, and we'll talk a little bit more about that, but even if it's at its most simplest levels, a rating system, which is just like providing it as an information service, is essentially you being able to use data to determine who is credit and non-credit worthy. And all the gray areas in between are variations. And ultimately, the decision would be made through a marketplace, and the rates that would be offered for that debt would alter based on the credit rating. This would create a new revenue stream for your company where you're able to provide credit rating services as Moody's or Finch or some of the other guys would provide, which would be advisory services using your data and benchmarking, which we talked about earlier, that the health facilities would be able to put a plan in place to increase their rating over time. Ultimately, what that does is it enhances the marketplace that you'll be building, and it provides it gives financial providers an ability to make a more tangible decision using granular information, which is unique, and that's what you have. So ultimately, getting that rating system in place is vital. The rating system, when it comes to credit worthiness, you're going to have to create and I use this, of course, in relative terms, but you need to create as many categories as possible. They need to be meaningful. They need to work together, so collectively exhaustive, but mutually exclusive, and they need to connect with one another. So ultimately, if you had just 3 categories and those 3 categories gave somewhat of a picture, but they don't necessarily link up properly, or you're not able to create different benchmarks, that go deep enough within those 3 categories, and ultimately your rating system will have some challenges in the sense of depth and ability of just reaching out in the sense of covering more things. So ultimately, this growth hack would have to have several different categories and then depth within those categories and a final score that brings all that together, and being able to describe this openly and transparently both to the health facilities and how they'll work through it, at the same time to the debt providers who will be able to make the decision according to credit worthiness or not. That would be how I see this growth hack working. If you have any insights or input on that, let me know, because I genuinely believe that this is pivotal to your success. Pulling this off right is going to set in motion everything else that's about to come, that's going to help you exponentially grow. That's from the position, from the information and the things that I see at the moment.
Yeah, I absolutely love the idea itself, and I see how it's connected with growth hack number 2, number 3, and I see how it's connected with our growth potential, because the only thing that stops us right now is the thing that we cannot get enough that facility to kind of sponsor all the healthcare providers. I 100% agree with you, Nader, and I love the idea 100%, and we're going to be working on it to kind of build up on it, connect it all together and make it happen.
Awesome. And then the good thing is that Kareem, and the founder of Klaim, has a background in this. I know a very extremely deep technical background, which is awesome. So you've got the internal capability to do it, plus the data. So there's actually no reason for it not to happen. But ultimately, I think I think one of the things I see in the sense of mindset, and I saw a really interesting post recently about this. So they have this post where they got a guy standing there and they're like, someone who's new to a topic and his view to the whole topic is out like this. And then they say, well, here's the guy next to him who's an expert and his perspective on the industry is that narrow. And so it's really, really crucial. And this is a growth problem, not just for you guys, but everybody, where sometimes we need to step back and we need to take that kind of narrow expertise and we need to start widening it, because possibility comes with the width rather than the depth. Depth is obviously when it comes to execution, implementation of our possibilities, but we need to be able to see all those possibilities and we need to be extremely creative in doing that, because again, I would say it again, it is pivotal to your growth. Get this right and everything else will fall in place one by one. And it helps you manage that supply demand issue you have with cash, bringing in the cash and dispersing the cash. This will not just put a filter in place, but it allows you to dispense and put cash in the most effective places in the right way. And you got to go beyond as well financial measures only. You need to look at other performance measures that connect to the financial parts of their business, because ultimately when you benchmark, you need to find levers, and that's where your fees that come in, identifying those levers and how to work those levers, then come back and look at the benchmark numbers to see if their score eventually changes according to that. So yeah, awesome. So that's it, right? Anything else on that?
Yeah, I think, thinking about it right now, we're trying to go to US as well. Kind of started a couple of campaigns there, getting some leads, talking to people. With the marketplace idea, the growth hack number one is if we hack it, then it opens up like our capabilities to bigger pool of investors from the West as well, which obviously what we're looking for.
Yeah, I mean, ultimately, yeah, and I agree with you. I mean, if you're able to get this market right, and this is a very big market, then ultimately you can take and replicate and eventually scale with the same kind of idea. In fact, I think you'd become an acquisition target for some of the large credit rating providers like the Moody's and Finch of the world, integrating this kind of expertise or capabilities into their broader services could be a huge thing. So obviously our goal here is not to get you acquired as of yet, but it's something to keep in the back of your mind, of course.
Yeah, 100%,
yeah,
100%.
Absolutely. Awesome, Vlad. Anything else before we move on?
That's all. I think that's all. We're going to be working hard on it, and awesome. Yeah, let's see where it goes.
Awesome, guys. So that is Vlad with Klaim. Klaim is a specialist in what we call revenue cycle management in the healthcare sector. To get more information about their story and what they're doing, head over to the kickoff video. If you want to get in touch with them, click below to get more information. As we tune out, anyone who wants to do what we do here in the challenge is all in the book here, Growth Thinking Design Methodology. Vlad, we'll see you in hack number 2. Good luck and congratulations on the KPMG top, what was it called? Top Technology Award? Is it?
Top innovator in the Middle East.
Top innovator Middle East. Congratulations. Well deserved. Keep it going. See you in hack number 2.
Thank you. See you guys. Bye-bye.